welcome everyone to Wednesday seminar in the Department of Population, Family, and Reproductive Health. I'm Cynthia Minkovitz. I'm chair of the department, and I'm also core faculty for the Child and Adolescent Health area of interest. Today, I'm really delighted to have the opportunity to moderate a discussion and welcome three colleagues who are involved with the Building Better Beginnings, or B3 initiative. B3 is a statewide prenatal to 3 collaboration in Maryland. The primary aim is to increase the quality and availability of programs and services and to advance policies for pregnant women and young children with a strong focus on equity and meeting the needs of families who are experiencing adversity, including families of color, English language learners, children with special medical and behavioral needs, and children from families and communities that are low income. It's really an honor to be part of a much larger team and to have experts from that team joining us today. So I'm going to introduce each of my colleagues briefly up front before asking them to share remarks, and then we'll leave plenty of time and open it up for questions and conversation because we're really interested in hearing your thoughts and perspectives. So joining us today are Dr. Felicia Jones, Ms. Alexis Campbell, and Dr. Barbara Andrews. So first, I'll introduce Dr. Jones. She's our awesome Prenatal to 3 project director at Maryland Family Network, where she facilitates the work of the Building Better Beginnings, or B3 collaborative. And she has worked in several areas of education, including Head Start, early Head Start, public pre-K, childcare, infants and toddlers, as well as in work focused on family engagement and involvement in food justice. Felicia holds a Bachelor of Science in Family Science and a minor in Public Health from the University of Maryland, College Park, and a Master of Science in Special Education and a doctorate in education from our own Johns Hopkins University. She's also an alumna of the Princeton Alumni Corps and the AASA Urban Superintendent Cohort Program. She's currently an Equity Leaders Action Network Fellow with the Build Network, so we get to get all sorts of advantages of all of her ongoing learning as she gets us all up to speed. And today she's going to orient us to the work of Maryland Family Network generally and the work of B3 specifically. Following Felicia's remarks, I'll make a few comments about our approach to using data to advance equity in the early childhood system. And then I'll turn it over to Ms. Alexis Campbell, who's a senior research program coordinator for the Early Childhood Services Research Program here in the department. She's been a longtime collaborator for Maryland's Building Better Beginnings work and New Jersey's Preschool Development Grant from Birth Through 5. And she holds a Master of Science in Public Health from our own School of Public Health and a Bachelor of Arts from Georgia State. And she's also first author on the Equity Report. So she knows all that work extremely well and firsthand. And then I'm going to turn it over to Dr. Barbara Andrews, who has worked in the education field in early childhood, elementary, and before and after school for 39 years. She has extensive experience in government, the nonprofit, and school sectors. And after working as a teacher in early childhood, she actually attained a master's in education and human development from George Washington University and a doctorate in education from George Mason. She's worked as an administrator, a grants and professional development specialist, a college professor and trainer with students and professionals. And while she's worked for all age groups from infancy through adulthood, her specialization has always been in early childhood education. She's currently the administrator for early childhood services in the Department of Health and Human Services in our own Montgomery County here in the state of Maryland. And so to start our conversation today, I'm going to invite Dr. Jones to introduce us to Maryland Family Network, which is the wonderful lead organization for B3. Felicia.
Well, thank you for that lovely introduction. It's always kind of strange to hear yourself being, introduced. It's bizarre, but cool at the same time. Well, hello, everyone. It's nice to meet you. It's lunchtime, so I hope you're, feeling free to chat and chew as we go through today's webinar. So again, I work at Maryland Family Network, but my charge is really Building Better Beginnings, which is housed at Maryland Family Network. So just to get us started, let's just kind of take a deep dive into Maryland Family Network. I'm going to quickly share my screen with you. So Maryland Family Network mission is to ensure that young children have strong families, quality early learning environments, and a champion for their interests. And I should share with you that we are an advocate and a catalyst for the development of a strong system of quality childcare, quality early education experiences, and family support. So we employ like a multi-pronged approach to kind of getting to that mission. One, you may be familiar with our family support centers, which are located throughout the state of Maryland in various jurisdictions. And quite frankly, I'm really excited to share that through the blueprint, the Kerwin Commission and the blueprint legislation that was passed, we're going to be expanding family support centers throughout the state of Maryland. So more to come on that. But family support centers offer high quality childcare, parenting education, health education, and access to health care, as well as adult education, parent leadership, and service coordination. That service coordination is very critical because the family support centers can't do their work alone. Because they're located in every jurisdiction, it's really important that they partner with other organizations in the community where they're housed. Next is Early Head Start. You may not know, but Maryland Family Network is the largest Early Head Start grantee in the state of Maryland. And almost 25 years ago this year, we opened our first 2 programs. And Early Head Start is characterized by a high quality infant and toddler program. Some of those services are home-based, and some of those, those services can be provided, in a center-based environment. Also offering parent and health education, service coordination, and parent involvement and support. And another critical area I would love to highlight about Early Head Start is a member of the Parent Policy Council is also a part of Maryland Family Network's board of directors. Another approach at Maryland Family Network is the Child Care Resource Centers, affectionately known as the Ccrcs. They help to really improve the quality of childcare in the state of Maryland and to expand that quality care, working with center-based and family-owned child cares. There have been over 26,000 providers trained since we started the Ccrcs, thousands of technical assistance cases, as well as, at this point, over 3,000 e-learning users using our networks to access training. Next is Locate Childcare, which is a service that Maryland Family Networks provides to families to help them find licensed childcare that meets their family needs. And I also want to highlight that there are enhanced services for military families, Spanish speakers, as well as children who have special needs. And lastly, our public policy arm, which is really helps to provide that strong voice. And like I mentioned earlier, that champion for children, we really look to our public policy team because they are in Annapolis at the Maryland General Assembly. They are also engaging at the local level, at the state level, and at the federal level to advocate for children and families in the state of Maryland. And quite frankly, Maryland Family Network has been known to be a trusted voice in this area. And now to us, the new kids on the block, I like to refer to us as, is Building Better Beginnings, or B3. Building Better Beginnings, we honestly just got to this name about maybe this time last year, but about 2 years ago, many early childhood stakeholders across the state of Maryland, they got together and said, hey, we want to go after this. At the time, it was called a planning grant with the Pritzker Children Initiative to figure out, okay, we want to look at the state of Maryland as a whole and figure out what are some areas that we need to strengthen. So we had universities and state agency leaders and childcare providers and parents, anyone, healthcare providers, anyone who touched the prenatal to 3 community had stake in these conversations of about how we can strengthen this system of care. And from that came an implementation plan that was funded in June of last year. So in June of 2020 is when we were awarded a 3-year grant to really begin to dig deep and dive into improving and understanding more about Maryland's prenatal to 3 system. And so from there, we became a part of the Pritzker Children's Initiative family. And so we have been charged to help them reach their vision that every child who reaches kindergarten is ready to learn, which many of us on the call in some way have a stake in that vision. So this is what they call their big, hairy goal of at least 1 million low-income infants and toddlers and their families will be served by high-quality programs by 2023. Now, 1 million is a really large number, so don't you worry. We have about 230,000 between that number of infants and toddlers in the state of Maryland, so we're not alone. We are joined by 20 other states and 10 jurisdictions across the country to help reach that goal. And I do want to highlight that Baltimore City is also a recipient of the Pritzker Children's Initiative funds to focus, and so the recipient is Be More for Healthy Babies, and they're also partners with us in this work. So shout out to Baltimore City for all of the wonderful work they're doing, and they are a lovely and wonderful partner with us. So now we've gotten to this point now, we have this vision that we want to see that all expectant families and those with children up to age 3 in Maryland thrive. And so we really will work to remove the financial and structural barriers that prevent these populations from receiving the high quality programs that they not only need, but they deserve. And so we've been able to drill down a mission to establish, enhance, and expand high quality programs and services for expectant families and those with young children. And along with that, increasing the awareness and critical importance of those early life experiences and how those experiences work together to achieve lifelong health and well-being. So that leads us to our goal. So we have 4 strategic goal areas. The first one being good health and healthy beginnings. We're really looking at high quality prenatal early childhood care and services that support the development of pregnant women or birthing people, infants and toddlers, especially for low-income families. The next area is strong families and family support. This is really important because we value strong relationships and positive relationships within families. And so we want to ensure that parents and families are able to access a comprehensive set of services that promote maternal health, infant and toddler development, and like I said, that overall family well-being. Next is the positive early learning experiences. So we're looking at high quality care, affordable infant and toddler care, looking at infant and toddler development, and also working with the childcare providers as well. So really looking at the whole early learning and classroom environment and how we can support that. And last, but certainly not least, is looking at systems and infrastructure development. So how in the world, as we make these changes over the next few years, how are we working to make them sustainable changes? So what's important here is how we are advancing equity and removing barriers. So early on, before I was even onboarded in this role, the key leaders team, who were pretty much the stewards of this work, adopted an equity lens as a key value. And so I like to draw, like, imagine yourself with a set of glasses, a pair of glasses on, and it's the one that you can, take your glasses off, you can put them on when you need them. But so what we want to do is keep our glasses on. We want to keep that equity lens on because it really is a defining feature of our high quality programs and services. Also, we are really interested in constructing policy goals that work toward targeted services. So we really are, if you look, we really are looking at income, we're looking at race and ethnicity, geography, language, ability, and more. We also want to highlight that policy change that promotes equity requires equitable implementation. And our report really does get to sort of how we get to equitable implementation. And then lastly, we had some equity experts look over our plan before we submitted it. And I thought that was important to share with you. But then that leads us into why we thought it necessary to embark on this inaugural prenatal to 3 report. The reality is Maryland is not a monolith. We have urban areas, we have suburban areas, we have rural areas. They all have very different needs. And although some of those, they may have some shared needs, the reality is we need to approach these areas and meet their, and try to best to meet their needs. So while we know some things anecdotally, right? Like if you live in a rural area, you can speak to some of the challenges and some of the awesome benefits of living in a rural area. But we also need to understand that we need quality data to help us make meaningful changes to enhance our state's prenatal to 3 system of care. I would be remiss if I did not clearly state that this equity report is not the first equity report framework that has been done in our state. There are so many people who are working on equity in our state, but I did want to highlight that this particular tool is, this particular report is a tool that can and will help Maryland help level the playing field for children and families. I think at the end of the day, we all want to have agency in our lives. And I think having candid discussions like what we're about to do today lead to meaningful actions that will help us get to that agency for all of our state's children and families.
Thanks so much, Felicia. What an awesome overview. And as folks can probably already start to see, this vision is impressive and awesome and also daunting. And so the real work, as Felicia said, has been ongoing in the state and in our jurisdictions for a long time, but we see this as an important sort of next step to have shared conversations and to increasingly develop a shared vision among all the stakeholders for Maryland's expectant families and families with young children. So with that, I'm going to put up some slides, thanks Alexis, to talk a little bit about what it means to use data to advance equity in an early childhood system of care. Next slide. Probably one of the most important things is to sort of think through what's the definition that B3 adopted for this work. So we think about the just and fair inclusion into a community in which all can participate and thrive, building on the work of PolicyLink and many other experts and organizations. And what this means is that we're really thinking about eliminating systemic barriers and their consequences. So some of these barriers are things that are well known to many of you in the work that you do, and for some of you in lived experiences around poverty, racism, and discrimination. And the consequences are really broad in the prenatal to 3 system of care. So there are things like lack of access to high quality health, education, and family supports. And these are examples that we've chosen because they align with the framing of the Pritzker Children's Initiative, which is supporting our work. But the vision of what this really means that Felicia spoke to is that our vision is that all expectant families and those with young children receive necessary supports in a timely fashion to develop to their full potential. And when we think about necessary supports, we're also embedding in our work and our thinking, these are supports that aren't sort of only necessary, but they're culturally appropriate, they're family-centered, and they're what families want. And so I think in some areas we have lots of successes already, and in others we have quite a long way to go. In contrast to equity, on the next slide are inequities. So I just want to do some shared language of our thinking. So these are differences that we would identify as being unfair, avoidable, and unjust. And our focus on inequities, I think, has really even more magnified now in the last 2 years amidst a global pandemic and a pandemic that locally across all of our jurisdictions in Maryland and elsewhere has really highlighted the profound inequities that exist. When we think about inequities, we think about differences, particularly those associated with social disadvantage. And these could be on any of these criteria as well as many others. And for the purposes of our equity report, Alexis is going to speak to our initial focus around racial and ethnic inequities and those by jurisdiction or geographic level. And in the report and in the broader literature, inequities are thought about in relationship to outcomes, and we'll highlight some of those today. but also in terms of resources and opportunities that are available to different groups of people, and in systematic ways where they are unfair, avoidable, and unjust distribution. Next slide. So to do this work, what we want to think about is, well, how do we think about equity within what's known as an effective data culture? So a lot of groups and leaders have spoken to what an effective data culture is, but in the work that we're doing, as we think about equity in relationship to data, we think about being really transparent in our commitment and our vision, as well as thinking about where we're at with regard to equity in our beliefs, and certainly with regard to accountability. So all of the key leaders sitting around the table, looking at early data, helping provide access to data, we're keenly aware that we all have a shared responsibility. So it's not just accountability to an individual organization or a program or a service, but a shared accountability across our communities and state. And then thinking about how we model the use of data, how we collaborate, and then how we use data for improvement in a CQI sort of way, or continuous quality improvement. So this is sort of what we're thinking about as we think about sort of effective data culture. And then on the next slide, when we think about specifically the data lifecycle, we want to think about how we embed racial equity in that work. And I'm going to highlight specifically racial equity because that's one of the two key areas by which we disaggregated the data that we were able to secure. So in the planning, we want to think about what are the questions that we're asking? Why is this work necessary? Who does the work benefit? How does it benefit the community at large? And what about the work that we're doing actually could produce harm? So thinking about unintended as well as intended consequences. Around data collection, we think about how we embed equity. This report is secondary data, but how we might also embed it in primary or mixed data collection methods is really important. Around data access, we've made our report publicly available. It's been disseminated through social media, on blogs and on the Maryland Family Network website, but there are decisions that folks make about restricted access, limited access, or no access to data when data are collected. And then thinking about data analysis, which I've already alluded to, and thinking about units of disaggregation, which are intentional and informative, and also thinking about data quality that Alexis will speak to, and some of what we observed. Again, a strong emphasis in thinking about embedding racial equity with regard to reporting and dissemination and having an upfront plan. And as Felicia said, we're building on work that's been ongoing in the state, but the real work of the report is not sort of what we've produced, but it's the process by which it came about and what we're going to do with it to develop more shared understanding across the state and help organizations think about how to use the report toward next steps. And then often not thought about in the data life cycle is what we call data purging, or actually getting rid of data. So while that's not the focus for us today, I think in thinking about research and practice activities, that's very important to think about how we, the timing and the method for which we get rid of data from being available for use to inform policy, practice, or other activities. So next slide. One area I wanted to drill a little bit deeper on, because we spent a lot of time thinking about this with a work group, was data visualization and racial equity in particular. So Schwabish and Fang, who are affiliated with the Urban Institute, have done some really great work thinking about what are some key aspects of data visualization to think about. And these resonate with the work of many other organizations as well. But thinking about the language that we use with the racial equity awareness, while also recognizing that the context in which data collected are specific to why these data are already collected when you're using secondary data. Thinking about how we order data labels in a purposeful way, and Alexis will highlight that in some examples. Considering who's missing from our data. So we struggled a lot with that, and we'll address that a little bit later. Sometimes we have sort of default approaches for how we visualize data, and those may not always be the most accurate, the most fair, or the most just, so questioning that. And it even drills down to thinking about colors, icons, and shapes to have awareness of racial equity. And then also thinking about how we demonstrate empathy in how we show data, and how and the extent to which we engage or reflect lived experience in how we portray data. So some of these seem very straightforward, but they're actually much harder to do in practice. And I think it really speaks to being very intentional and explicit about how we're going to visualize data and for what purpose, and what are some of the trade-offs in the decisions that we make. So with that, I'm going to turn it over to Alexis and ask her to give us an overview of the report. So Alexis, go ahead.
Great. Thank you, Cynthia. I'm excited to be here today to give a pretty quick overview of what's in the Maryland Prenatal to 3 Equity Report, and just a quick overview of parts I'll be touching on today. First, I'll go over the rationale and objectives. I'll say a few comments about the methods, go over some select results, our strengths and limitations, and then a few recommendations. So the rationale behind the report, Maryland's, like many other states, has a population of young children that are racially, ethnically, and culturally diverse. And like Felicia mentioned, our key leaders group determined equity as a key focus area in our planning grant period. And thinking more on a system scale and what we know about life course theory, we know that early disparities can decrease the likelihood that children and families reach their full potential. But something that can buffer that is equitable early life experiences, including what Cynthia was talking about, guided by families, being able to access the services they desire. These sort of experiences can serve as formative inputs to adult educational attainment, health status, and economic self-sufficiency as well. And the report has 3 main objectives. The first one being characterizing the extent to which Maryland has achieved an equitable prenatal to 3 system of care. Second is identifying strengths and gaps in data available to measure equity. And then it ends with making recommendations to advance equity for Maryland's prenatal to 3 population. And so you can see our data collection period here took place during COVID. And a lot of the data we collected came from our state agency partners. This includes the Department of Health, the Department of Education, and the Department of Human Services. With agencies, there are a lot of staffing changes and shortages due to COVID, as well as shifting priorities to meet pandemic needs. Some other data sources for the report include vital statistics, the American Community Survey, and also data requests sent out to nonprofit partners as well. And all of this led to 24 indicators across 5 domains. The first one being general population estimates, the second one being health and education outcomes, and then the last 3 relating to the key goal areas Felicia mentioned in her presentation, which include healthy beginnings, supported families, and high quality early care and learning. And as Cynthia mentioned, the focus for this report was really equity regarding race and ethnicity and geography. It's by no means exhaustive when it comes to looking at equity by different characteristics. But since those were the 2 focus areas, we collected data, and all of that was dependent on availability and sample size limitations. But when possible, we collected indicators at the jurisdiction and state levels, and then disaggregated data by race, ethnicity within each jurisdiction. And I say jurisdiction instead of counties because if you live in Baltimore City like me, it's its own entity. And so in total, Maryland has 24 jurisdictions, which includes Baltimore City and all of the counties as well. And the second part speaks to what Cynthia was talking about in her presentation, thinking about how we categorize race and ethnicity. And so under the guidance of our equity report work group in the planning process, we decided to adapt certain things in the narrative. And one of them was for birth outcomes. We decided to list people as what they identify as, instead of listing or leading with what they don't identify as. So an example here is for race categories for birth outcomes. We, for example, changed something like non-Hispanic Black to be Black with non-Hispanic in the parentheses. And then for our Department of Human Service outcomes, we opted to change Caucasian, which is an outdated and not relevant term for most white populations, to be white. At the same time, though, we opted to keep race and ethnicity categories as they were given to us from our original data sources in the appendix, just to sort of highlight the variation across programs in terms of reporting. And now I'm going to go over some results from the report. So here, this is an example of our population indicators. You may be wondering why it goes up to through age 5. This is because thinking about sample sizes again, the population of children under age 3 in Maryland is around 214,000. And once you start teasing that apart by race and percentage of children living in poverty, it gets a little bit too small to be reliable. So we opted to use this larger indicator, which is around 430,000 children under age 6. And it's grouped year data as well. It's more reliable. And if you see here, we decided to, in this graph, organize by race and ethnicity, starting with like the lowest percentage living in poverty, going all the way up to the highest percentage living in poverty. And the Maryland state average is around 1 in 8 children living in poverty. But you can see by race and ethnicity, there's a lot of variation. And for some other race and Black African American categories, it is as much as 1 in 5 children living in poverty. And this really highlights the disparities experienced by different race and ethnicities. And this is another bar graph, this time showing one of our birth outcomes, which is infant mortality, which is the number of infant deaths per 1,000 live births. You can see on the left-hand side, these are our adapted categories. And again, this shows the variation by race and ethnicity. As Cynthia pointed out, these categories are very different than what we saw in the previous graph, and that's because different programs use different categories. And so if any are missing, it's because the sample size was too small to calculate. So again, want to point out here for infants born to Black non-Hispanic women, they experience the highest infant mortality in the state, which exceeds the state average, but also is 3-fold higher than the lowest infant mortality rate. And this is another way of looking at infant mortality. Again, goes back to our focus on geography. We wanted to highlight the variation by jurisdiction. And this is grouped year data again for reliability and being able to compare jurisdictions. So the average is a little bit different at 6.3 deaths per 1,000 live births. And the darker shaded counties have the poorer outcomes, which is the higher infant mortality rates. And the lighter counties have the better infant mortality rates. You can sort of see how it varies jurisdiction to jurisdiction. This is another map that shows variation in kindergarten readiness by jurisdiction for the 2019-2020 school year. Even though the color are flipped here, it still shows the darker colors have the poor outcomes, because when you're taking an assessment, a lower score is worse. And actually 11 jurisdictions in Maryland fall below the state average of 47% demonstrating readiness. And another important thing to note here is that no Maryland jurisdiction meets the state goal of having over 64% of children demonstrating readiness. And this last figure is a little bit different. We call them donuts. It shows the difference in participations by race and ethnicity. And this is for one of our service indicators, which falls under our supported families domain. And this is for SNAP, or the Supplemental Nutrition Assistance Program, which was formerly known as food stamps. This helps families with low incomes be able to access nutritious foods. And so this is all for households with children under age 3 participating in the program. There are 2 data challenges I want to highlight that you can see in this graph. The first is for race. 42% of race is unknown. And that is because for federal programs and programs like SNAP, the race and ethnicity questions are not mandatory to answer because race and ethnicity cannot and does not determine eligibility for the programs. And then the other thing is the discrepancy between Hispanic on the race donut and Hispanic on the ethnicity donut. In this program, race and ethnicity are asked separately, and so you can select Hispanic as a race and Hispanic as an ethnicity. And so on the race donut, this is only people who selected Hispanic as a race. In the Hispanic donut, it's people who selected Hispanic as a race and also Hispanic as an ethnicity that can be any race. And so that's why it's higher. And then we have a few strengths to the report. Again, thinking about the indicators that we included across our 5 domains, being able to disaggregate by race and ethnicity and jurisdiction. And then the one that we're most proud about is engaging multiple agencies and organizations throughout the process. Limitations, even though we included race and ethnicity, some indicators didn't have that information available to use. And like I mentioned, programs collect this information differently and use different categories. So it's harder to make comparisons across outcomes. Even though we included 24 indicators, that's still a subset of what could have been included in the report. For a lot of program and services, we don't have the denominator, which is who would be eligible for the service. We're not able to assess variability within jurisdictions. And then we did not include direct parent or family voice when making the report, which again, highlighted by both Cynthia and Felicia. Lots of programs and services that we worked with do include parent and family engagement and leadership in their work. And now B3 is actively working to embed parent and family engagement more in the processes that we do, and we plan to include parent engagement more in our next report. And then finally, for recommendations, we have 6 recommendations in the report, but I want to highlight 2 here, thinking about our equity lens around data. So number 5, again, really speaks to what Cynthia was talking about, in that we need to think systematically on how race and ethnicity data is collected, what categories are being used, how the questions are being asked. Is it self-selected, or do programs just take a guess? And then once that data is collected, how can it be used, and how is it being used? And then number 6 is future reports should incorporate information about individuals eligible for services. This would help better inform and give us ideas on how to address disparities that we see in service data. And quickly, I just want to acknowledge the key leaders for B3, some of which are on the call today, all the organizations and stakeholders that provided data for the report, and then our funder, the Pritzker Children's Initiative. I will drop the link to the report in the chat, but I will go ahead and pass it back to Cynthia.
Thanks so much, Alexis. And we'll probably come back to the recommendations that some of you may have some thoughts about in the Q&A. But before we get to that, I'm going to turn it over to Barbara to give us a perspective of the role of the jurisdiction, an important one in the B3 initiative. So Barbara, thanks for joining us.
Thank you. And thank you everyone for joining us today. I actually used to work for Maryland Family Network, so I'm very pleased to be part of this work. I'm going to give you just a couple pieces of information about Montgomery County, Maryland, in case you're not familiar with it. And sometimes people have some understanding of our county that's not quite accurate. So I'll give you just a few pieces of information. We are over 1 million residents and counting. We are the largest jurisdiction in Maryland, and with 43% of our population being white, we are a minority-majority county. Some of our larger populations are Hispanic, Latino, Black, African American, Asian, and then we have a growing Ethiopian community and a growing French speaking from various African countries. We are a magnet for immigration. Apparently our immigration of new residents to the county surpasses the state, region, and the nation in terms of immigrants coming to us. We're of course right next to the nation's capital, so that's probably part of the draw. We are known oftentimes as an affluent county, which we are, but we have dense pockets of high density poverty. And we also have high need areas in terms of both poverty and services, but also in terms of childcare, where we don't have enough childcare. Like most of the state, we have lost family childcare homes at a fairly large rate over, say, the last 10 years. And we have started a project, which is part of the positive early learning experiences of the B3 project, but it's also a major project in our county. We do have a new early childhood initiative, which is rather large, that our county executive started when he came into office 3 years ago. And it is one of his top priorities was early childhood. And we also have a champion in our council, Nancy Navarro, who helped build the infrastructure for this initiative. And the initiative challenged us to really focus in on recruiting family childcare providers from across the county and increasing our family childcare homes. So Alexis, if you want to put up the first slide. So we have developed a model that we call Growing Opportunities for Family Childcare, or GO FCC. There it comes. And we do this as a recruitment and retention project and effort, so that we are not just recruiting providers and sending them on their way, but helping them along the way to retain and build their program. We use a cohort approach, and this is part of the model. I would have to say the majority of the folks who are wanting to start family childcare homes are Spanish speaking. So we do have cohorts in 2 tracks. One is usually English, one is Spanish. And they move through these steps together along with receiving one-on-one support to get through. This first slide is related to becoming a registered family childcare provider. It's called registration in Maryland. It's the same as their license. And instead of providers being sent some paperwork and being asked to build their business and do these pieces and all the paperwork on their own, we provide a lot of assistance in doing that. We've been able to recruit 120 new family childcare providers in the last 2.5 years, including during a pandemic, which I thought was fascinating because I think people were really looking for opportunities in the time where maybe they weren't at their regular jobs or their children weren't in school or whatever might have drawn them to family childcare. So we have also managed to reduce the time for receiving your registration from 9 to 12 months down to 4 to 6 months. So this is a basic 4-month setup that you can, I'm not going to go over every detail, you can look at the pieces for yourself. We split up the process in order to make it more manageable. They're offered one-on-one support primarily in their preferred language. We use interpreters for languages other than Spanish. We have staff who are bilingual in English and Spanish and contractors who are bilingual in English and Spanish. And we provide the full, all the requirements for training that they have before they can receive their license in both English and Spanish classes. And the cohorts moving together really provide them support for each other. Another piece is that we set them up with an ambassador or a peer mentor so that they are getting support that is culturally relative to them, so that they're getting it in their language, and they're getting somebody who's in their community or in their neighborhood and is very experienced in family child care. We do offer business supports, which is mentioned here. And we have a women's business center in Montgomery County that does things bilingually for us, and they do a fantastic job of helping with specific business supports for setting up a business, which is what family child care is. And we have a lot of relationships, strong relationships with all the different departments, whether it's the state office of child care that actually does the licensing, or whether it is our permitting office or whoever might be involved in helping move this along so that we can make the process easier and faster and simpler for the providers. You want to go to the second slide? And so we have 4 phases to this process. Once they've established their business and they've gotten all of their registration papers approved by the State Department of Education, we help them go through a business launch, a professional plan. That includes, we do have a quality rating improvement system in Maryland called Maryland Excels. That includes getting them published in Maryland Excels, participating in the child care credential at the State Department of Education, and also selecting a career pathway. Many people are interested in either getting a 2-year degree or simply getting a lot more professional development, some a 4-year degree. We work closely with Montgomery College and all of their pathways to early childhood degrees and send them over there to get the counseling that they need, or we help them with whatever they want in terms of their own goals, their career. We work through this as a profession. We do not, and as a business, we do not just work through it as something that you do for a couple of years. We want them to build their professional capabilities. Because of our initiative and some of the funding, we're able to have dedicated staff. That's one key thing for this program, and dedicated staff who are bilingual. We are able to provide a grant to the providers for setting up their program, buying some equipment, book, curriculum, whatever that might be. We help pay their first permitting fee, and we help pay their first year of joining an association so that they can professionalize their work and start networking. We are, I think, the only jurisdiction in Maryland that has a child care health consultant who is a nurse who goes in and helps them support the health parts of their program. And if they have any children with serious health needs, the nurse is there for that consultation. We gradually move them to teaching assessments and improvement, creating an improvement plan, and moving towards accreditation of the program. We do target specifically 5 zip codes in our jurisdiction, which are the ones that I mentioned, are the high density poverty areas, and they also are likely to not have as many child care programs, and certainly not as many family child care programs. We provide, as I said, one-on-one assistance in their home language. All of our training for all of this and much of our licensing required training is available in Spanish and in English. And I already described the peer mentor. One of the things that has happened from this is that there was a piece of legislation in the Maryland state legislature to start a pilot, Go FCC, based on this model for 3 jurisdictions to be able to start what works for their community, but we will help them by explaining to them what we've done through our cohort approach and this phased approach. Do the work. And I think that's basic overview. If anybody has any questions, or if Cynthia wants to ask about the equity report.
Great. Thank you so much, Barbara. I think it gives folks a sense of just the depth of expertise that is in place, particularly in Montgomery County, but also across other jurisdictions in Maryland to help achieve the vision for the much broader B3 equity report. So I'm going to go ahead and open it up for questions. Alexis, if you could take everyone off mute. Folks can either raise your hand using the toolbar, or you can place a comment in the chat. And while folks are getting their questions together, Felicia, I'm going to take the prerogative of moderator to ask you the first question, which is, how difficult or not has it been to sort of advance equity within the B3 initiative when this is all happening amid a pandemic?
What a question. The plan was written and ready to be executed before the pandemic hit. So quite frankly, there has been a lot of grace given because agencies, organizations, programs needed to wrap their head around delivering services while keeping, their staff safe, keeping their participants safe. I think I know that has been a challenge because, like we shared, there's so many stakeholders involved in this work. And so being able to keep up and keep track of what the new focus on, what is the new project that you're working on? Is this still connected to prenatal to 3? Is there a way that we can modify our implementation plan to the funders, let them know these are some of the challenges that we're having in Maryland. And quite frankly, this particular program is no longer a priority. It has been defunded, or they've actually changed and it's still related to prenatal to 3, but it's a little bit of a different scope. I think the Great Resignation has played quite a bit of a role in the implementation of this plan. All of our organizations, all industries are experiencing a need in the workforce. I will say some of the positive spin has been the benefit of meeting monthly with this key leader team, that we still have been able to maintain our commitment to meet with one another. We still have those important stakeholders at the table. The willingness from our group is still there. Despite all of the way that their bandwidth, all of the ways that they're being pulled, there's still a demonstrated commitment to participating in this work. And also another thing that we were able to do in this pandemic is start these work groups, these Building Better Beginnings work groups. Although it was a challenge to get started, we have work groups for 3 of our key strategic goal areas that are filled with many different stakeholders. We have researchers, we have providers, we have parent co-leads, co-chairs. So we've gotten our parents involved. So we are really excited. So despite the challenges of this work, we still have a demonstrated commitment from not only our key leaders, but other prenatal to 3 stakeholders who want to get involved. So
it's great to sort of share, Felicia. And I think the commitment, despite everything else happening, really speaks to the possibilities for sustainability for keeping this work going forward, even after the period of funding. So eager to think more about that. I see a comment in the chat about revisiting the recommendations from the report. So we're going to try to add those to the chat. And while we're doing that, I don't see any other hands raised. Barbara, I do see one now. Hold on. Fujan is asking, have you been able to add COVID to your program, and how is there a need to equally distribute the vaccine and access to health concerns around COVID? So I'll start that, and then Felicia, I'll let you jump in. So we are not focused sort of specifically on COVID. That said, we're keenly aware of the needs of families and communities in ways where thinking about resource allocation and distribution requires an equity lens. So there are many, including our key leaders in their own organizational roles, for whom COVID is an important focus. Folks have adapted service delivery strategies, whether it's home visiting service delivery strategies that went fully remote, or thinking about how to support family childcare providers to resume services in safe ways, or a whole range of others. So many of our partner organizations have had that front and center of their activities, but it's not the direct focus for B3. Felicia, I don't know if you want to add to that.
No, I think you covered it.
Great. And then in response to the question in the chat that Martha posed, Alexis kindly put the recommendations into the chat about what came out of the report. And folks may have some observations and comments to that. We're happy to talk about them. The 2 that Alexis highlighted were the last 2 about encouraging organizations to systematically collect and review race and ethnicity data. So I'm going to start with that one, which is to say that even among our agencies in the state that are not required to collect race and ethnicity, they recognize the value of doing that, but wanting to do it in ways that are culturally appropriate and don't have families not want to sign up for services for concerns as to why those data are being collected. So there's a lot of ongoing work to enhance data quality. We also come up against some federal requirements. So for some programs that are available to our state residents, the federal government actually prohibits us from mandating the collection of race and ethnicity. And so Medicaid or public health insurance for low income populations is one of those programs where we are federally restricted from mandating the collection of race and ethnicity data. So I just want to throw that as an example. David, I see you have your hand up.
Yes, thank you. Fascinating. My question is whether there's any consideration being given to integrating the services in a way that makes it both comprehensive and immediately available. And I've always wondered why Medicaid, as a payor for so many of these activities, would not integrate them in a way that is available, immediately available, and can be tiered against whatever the current poverty standards are for participation in a program. And it would certainly meet the PN3 objective.
I can take the first sort of stab at that question. I'm going to put in the chat. There is a nationwide focus on this now in the prenatal to 3 community. The prenatal to 3 roadmap is something I like to reference. Like I said, Maryland, our B3 hasn't necessarily adopted this, but we do reference it quite a bit. And there is talk about lessening the burden for families. So in COVID, for example, there have been many federal guidelines or mandates that have been relaxed. For example, with access to WIC programs, you know, you're able to do a lot of your appointments remotely. And so that's something that in the Child Nutrition Reauthorization Act, that'll be sort of discussed and mulled over in the next couple of months, early next year. They're going to be looking at making some of those changes permanent. And so what I've been doing in the state of Maryland is reaching out to certain stakeholders, like some of them you have lifted up, to figure out what can we do as a state, or what do we have sort of the space to do as a state to lessen the burden for families. Do we really need to have a 6-month recertification process, or can it be moved to a 12-month recertification process? So those conversations are being had as a part of B3. And I'm going to put Maryland's roadmap from the University of Texas in the chat. And I think that's a great resource for us to use outside of B3 for prenatal to 3 stakeholders to really start to really take some jabs at, you know, our prenatal to 3 system. Like, how are we really serving families? And is there a way to do it differently? Is there a way to do it better? And I think some of the recommendations that they pose are a way.
Thank you.
Thanks so much, Felicia. David, your comments about service integration is sort of music to our ears. And I think thinking about what those strategies are at the federal level versus the state level versus the jurisdictional level, I think are critically important, because it really takes all 3 to be able to do it effectively. So appreciate your raising that as an important area to consider.
Thank you.
Sure. Alexis also added to the chat, Maryland has a statewide integrated health improvement strategy, which in part leverages funding for Medicaid to support home visiting expansions, reimbursement for doula services, and a variety of other programs that are listed here, which could be very advantageous for the prenatal to 3 population in the state. As well as a new model that CMS, Centers for Medicare and Medicaid, is supporting federally for the maternal opioid misuse initiative, or the mom model. So all sorts of sort of pieces around service integration, but it's a really big elephant to tackle, right, in terms of integrating, because there's so many different services and so many different needs, but important to think about.
Great.
Shoshana, thanks for your question in the chat. Felicia, I don't know if you want to expand on this a little bit from some of the work group activities about engaging community members in our work in developing solutions and promoting equity as part of our sort of second recommendation, which was one of our strategies that came out of the report.
Thanks for giving me a second to read that question. Yeah, so a part of the work groups is that was something that when I came on board as the project director, I said, hey, where are the families? Like, where are the people who we're serving? And so we immediately got to work, wrote an additional grant to fund our work with families and provider voice. So out of that came the 3 work groups. So one is, we have one right now for good health and healthy beginnings, one for strong families and family support, and the other for positive early learning experience. These work groups are comprised of practitioners, researchers, providers, and families. So we're all working together and kind of coalescing around what we're going to do as a team. And actually this month we're meeting to finalize sort of our research agenda, and as well as some other projects that we would like to complete in our time together. I also would like to share that we realize that it is critically important to have families be at the table. So as a part of that, our co-chairs for these groups we recruited specifically parents or childcare providers, and we compensate them for their time as well. So we really recognize the need to have community involved in this work. And that was something that was not completely missing in the beginning, but it's something that we realized that we needed to actualize immediately. And so we've been working together for about 6 months now. So we're very new in this work. And so there's some kinks to work out, but we're really excited to kind of have this strong group of Marylanders in this. And so we have representatives at the local level, at the state level. So that's really exciting to have those different perspectives. And we have some really robust discussions around sort of in the service delivery. So the provider and then the recipient. And we're kind of coming to and having some really interesting conversations about what is it like as on the receivership, on the receiving end of the services. And we're starting to make change within our systems within these groups. So I'm really excited and thankful that you asked that question.
Sure. So we also have, I think, time for one more question. So I'm going to see if Rebecca wants to come offline, or if you want me to read your comment.
Sure, I can say it out loud. Thanks so much for your presentation. I just wanted to ask if you could talk a little bit more about how you disseminated the report and its findings, and if you have any future plans coming up to further disseminate.
Sure, I'll start, and then I'll let Felicia and Barbara comment as well. So as Felicia pointed out very early on, the report is a step in our work, but it's really only a step, and it's what we do with the report that matters the most. So thanks for asking, Rebecca. And it's also great to have an alum participating in the seminar today, for those of you that don't know Rebecca. But we have done a presentation as part of an endowed lectureship that Maryland Family Network offers, which has a lot of childcare providers and early educators in the state participating, known as the Skolnick Lecture, with a keynote who really introduced many critical concepts around racial equity. It was an awesome, very well-attended discussion, and that took place, I think, a couple of weeks ago. I can't quite remember. The report is being disseminated in social media. We also had a press briefing along with some Maryland legislators at a child care center, and had some great press coverage on WBAL and other outlets, thanks to the talents of Doug Lent, who is a communications guru at Maryland Family Network. But really, I think for the deep work, it really is going to be going to various groups within the state to have really in-depth conversations, to reflect on the data that pertains to their organizations, to learn more about what they're doing that they think seems to be working, to lift up a focus on equity within their jurisdiction and by disaggregated groups, and then to hear what strategies they're putting in place. Where do they need more resources to do their work well? So I think Barbara, in your remarks about the investment and thinking about, family childcare expansions in very under sort of served settings where there aren't enough childcare providers and the need is really high, and how you chose those low income, high poverty neighborhoods to be able to do that work, I think is one critical example. But I'll turn it over to Barbara to see if you have other thoughts from the perspective of a very large, diverse jurisdiction in the state about other ways to use the report.
Well, one of the things I did forget to mention is that the county has enacted equity law in Montgomery County that began in 2020. And that is now, we are developing systems within the county. We have a chief equity officer now in the county executive's office. And we're developing systems so that every time we make decisions, whether it's about budget, whether it's about resources, whether it's about where we're where we're putting our work, we are utilizing that equity frame. So this report really helped us because it allows us to focus in on birth to 3 and an equity frame. We have a lot of strong focus on early childhood in Montgomery County, but as you can imagine, sometimes people don't really understand birth to 3. So to have an equity report that even just provides us how many births to 3 are in the jurisdiction is a valuable piece of data for us. And the only other thing I'd say about our recruitment and retention effort is all of that, doing the cohorts, doing the one-on-one, having the ambassadors, that's all about the qualitative pieces of data and the stories that people bring and their own context. We all love our data reports and we all love our numbers, and they're very important when you're looking at big structures, but when you get right down to serving people, you have to hear their stories and it in the context of their lived experiences. And I think this project really helps us to do that.
Thanks so much, Barbara, for sharing that. I'm mindful of the time. Felicia, any other comments that you want to add to this?
I just want to thank you all for your time. And to that last question about dissemination, we hope that you will be able to disseminate the report to your networks. Or invite us to come and talk to your groups. Like, we really want to be in conversations and really talk. Nothing's going to get done without people really understanding what's in this report and us having conversations about how we can advance equity. So please, 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 I guess as a follow-up, I can put my email right in this chat for everyone, but we would really love to get out and talk about this, this report. So thank you all for being here.
Thanks so much, Felicia. Huge thanks to Barbara and to Alexis and to all of you for engaging. And we're looking forward to continued conversations to improve well-being and our focus on equity within the state of Maryland and beyond. So thanks everyone for being here. And we look forward to continued work together.